National Nurses Week means a lot to me in the sense of it's just nice that we just take a week of time and throughout 365 days a year to say, here are our nurses. This is what they do. We appreciate them. We love them. It's just like any human, it's nice to be noticed and to be recognized for something, especially if you love to do it, which, anyone in this field, if you are a nurse, you love to do it.
What it means for me to be a nurse is to be able to have that ability to help somebody through process of illness. As an oncology nurse, sometimes through the process of dying. That is such an honor to work with the families and to help them do that. And it also means that I have a part in this community, Gainesville, to help their sick and to help get them well.
I've wanted to be a nurse since I was 4 years old. I've always known I wanted to be a baby nurse, is what I called it back then. So it's just something that's always been in my heart to do. And I just love being a nurse and being able to help people at their lowest points and, bring some kind of joy.
I'd like to think that I make an impact on my patients' lives, but they also make an impact on me. So I have one patient that, till this day, I still keep in touch with them. He and his family were in a traumatic accident, and he came to our unit, and we were taking care of his wounds, and they didn't know if he was going to be able to walk. And a year later, he came in to my clinic, and he hugged me, and it was the most fulfilling feeling that you can have, just watching your patient and coming back and just reaching out to you, and the way that we connected. So till this day, we still keep in touch.
Well, what made me decide to be a nurse, this is the fun part, is that when I was in college back in the late 70s and early 80s, I went to school. I was going to be a math teacher. I got in with a group of people that were starting a first aid squad for the campus that I was working at, that I was going to school, and I was fascinated with it. I still wanted to teach, but I decided that I would make my focus teaching in the hospital and teaching one-on-one with kids and helping them to learn about their health rather than sit in a classroom. I found that the classroom setting just wasn't for me.
Shands has given me just so many opportunities. So right now I'm currently in the Leadership Fellowship for Nurses. I've just had the opportunity to advance in my career and advance in my knowledge. The surgeons are amazing. The collaboration between the surgeons, anesthesia, nurses, surgical techs, everyone just involved in patient care just really allows for the flourishing of an individual. So it's definitely here at U of Health, and I love it. Love it.
Throughout our careers, through all life's experiences and continual changes, our idea of what it is to be a nurse will also change. Embracing the good with the bad and learning from these experiences strengthens our journey to excellence in nursing.
When I think of who I am as a nurse, I remind myself of who I strive to be. Not one that possesses power and authority, but one that leads others by being positive and encouraging.
As a nurse, I'm a part of a team that provides patients hope when they receive a devastating, life-altering diagnosis. I provide patients and their loved ones the comfort and compassion they need to lift them up out of their lowest places.
My life goal was to be a nurse, and it didn't happen until later in life, but it has defined me. This is what it means to be a nurse for me, completed.
Nursing is more than a job, it's a calling. Even though we may spend 12 exhausting hours at the bedside, it's worth it knowing that you made a difference.
I truly believe that I have been blessed as a nurse in order to be a blessing to others. You take care of people at their worst moments, but that's when the light seems to shine the brightest.
Nursing isn't only a science that dictates our practice, it is an art that shapes a new generation of nurses.
We are visionaries, we are critical thinkers, we are teachers, and we are advocates.
It is helping, encouraging, loving, and nurturing people holistically in their greatest time of need.
I'm a part of making this world a better place, one patient at a time.
In the words of Maya Angelou, they may forget your name, but they will never forget how you made them feel.
I continue to nurse, to serve, to grow as a person, and I thank every patient that showed me along the way.